Welcome to the Fitness Simplified podcast. I'm Brooke Davis, women's functional nutritionist and fitness specialist with Elysian Women's Wellness, and I'm here to simplify your fitness.
The content provided in this podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Any information provided about nutrition, supplements, or fitness is based on personal experience and should be discussed with your healthcare provider before making any changes to your diet or lifestyle. Remember, your health and well-being are unique to you. What works for one person may not work for another. So always consult with your medical professional to determine what is best for you.
Today's topic is one that I know so many of you have struggled with, and that is getting the right labs ordered from your doctor in perimenopause. You have probably been there. You maybe explained some of your symptoms, the fatigue, the weight gain that won't budge, the brain fog, mood swings, whatever it is, only to hear that's just part of getting older, or yeah, you're about that age, or maybe even, your labs are normal. There's nothing else we can do for you. It's frustrating, it's dismissive, and ultimately it leaves you feeling really stuck. So here's the reality. We know your hormones are inconsistent right now and causing some of the issues, but it's not necessarily the whole picture. And so being able to understand what is actually happening inside your body during this time of hormonal transition is essential to taking control of your health and your symptoms. But I know that for so many women trying to navigate the healthcare system and advocate for the right tests, this can feel like an uphill battle, which is one of the reasons I am so excited to officially announce that along with all of the functional labs that we offer, we can now order hundreds of blood labs. Of course, we do not replace a licensed healthcare provider, but if for whatever reason, whether you don't have insurance or you don't have a doctor that you feel like is supporting your health and wellness the way that you need, or you just want to bypass the conventional disease care model that we have here in America, we can help you fill that gap. You are also able to use HSA and FSA for payments with testing or any of our services at this point, which is really amazing progress in the field of true wellness, and I am so grateful for it. Regardless, though, of whether you are going to work with us or go the route of your doctor, we want to be here to help support you through that. So today, we are going to break down the most valuable blood labs to get done that if you have it, most insurances should cover it as preventative care, especially if you have family history of things or a history yourself of various things, when to get them done and how to approach the conversation with your doctor. So this episode is all about empowering you to advocate for yourself, giving you the tools to take the next step toward better health, even if it means maybe seeking alternatives outside of your traditional healthcare. And of course, sharing how we can do that. So without further ado, we're going to start with hormones because this is one that a lot of doctors just won't do because they say it doesn't matter in perimenopause, but it does and it can. So first up is estradiol. This is the main form of estrogen in the body, and it is the key player in regulating your menstrual cycle, your bone health, your mood, even skin elasticity. So during perimenopause, of course, we know that these levels fluctuate wildly. Some days they're super high, other days they're tank. And of course, they do this throughout your menstrual cycle as well. And it's these ups and downs that lead to things like irregular periods, your hot flashes, mood swings, and so much more, like I said. So testing estradiol helps us see kind of where you're at in the hormonal transition and helps us create strategies to actually balance, stabilize things for overall well-being. I'm not going to dive super deep into all of these because I want us to be on the testing. I have other episodes that dive into actual hormones. And then progesterone is next. So this is the kind of calming hormone. It supports sleep, reduces anxiety. It balances the effects of estrogen. That's something we see a lot is the estrogen dominance. So in perimenopause, this is usually the first to decline. So that can lead to the insomnia, irritability, heavier periods. So testing this progesterone level gives us insight into whether you might need more support to restore balance, especially if you're feeling overwhelmed, you're having trouble winding down. The best times to test for estrogen and progesterone are going to be days 19 through 21 in a 28-day cycle. This is something that doctors often completely overlook. Or 5 to 7 days after ovulation. And that is adjusted for if you regularly have a longer or shorter cycle. If you don't have a regular cycle, if you're already kind of sporadic, you can do ovulation testing, basal body temperature tracking, and then test at the appropriate time based on that. So you do want to make sure to plan your blood draw around that time if you want to test for these and get, like I said, the most kind of accurate or best levels in your picture. Also, like I said, keep in mind that a lot of times doctors will argue that you don't need to test for this, etc. This is not necessarily a diagnostic test, and your levels will fluctuate throughout the month and over the months as you're going through perimenopause. But that being said, you can still potentially draw some clues about your health, further ways to support your body by knowing where these are at when they're supposed to be at their peak. Next up is testosterone. And yes, women have testosterone too. It plays a big role in libido, muscle maintenance, energy, mood. And so in perimenopause, of course, like everything else, testosterone can dip. This leads to low sex drive, fatigue, difficulty building and maintaining muscle, which is part of that metabolic decline. So testing your testosterone levels can be really important in figuring out whether, of course, these are contributing to some of the symptoms that you're having. And if you are a candidate for it, of course, supporting testosterone, lifting, that kind of thing, but also HRT interventions can definitely be helpful for that. Next is cortisol. So this is also commonly tested with blood, but this is your primary stress hormone. It's produced by the adrenal glands. It does have a natural rhythm throughout the day. So it's highest in the morning to help you wake up, and then lower in the evening as your body gets ready for sleep. And in perimenopause, stress and hormonal changes can throw this rhythm way out of whack. And then we see things like fatigue, sleep issues, weight gain around the middle. Most doctors only test cortisol with blood, which gives you really a very vague idea of what's actually going on with your cortisol. If you test with blood, you want an AM reading, so between 8 and 10 when it should be the highest. If that is off, then you may want to dig a little deeper. It may also be something you want to dig a little bit deeper on if, the rest of your levels are like somewhat normal, and yet even if this is normal with blood, ideally, you want to test this with saliva throughout the day to see where your diurnal pattern is and see where your cortisol is off versus just the one blood point in the day. To note, blood also shows us total cortisol versus saliva will actually show you usable versus total. And then if you use the Dutch test, this can show you metabolized cortisol as well. So this gives you just more insight into how your body is making it, using it, processing it. This will tell us basically if stress management or adrenal support might be needed to help you feel more balanced and reduce some of those symptoms. Next is DHEA. So this is another hormone that is produced by the adrenal glands. This is a precursor to both testosterone and estrogen. So that means your body uses it to make these two main sex hormones, which is partly why stress management throughout perimenopause is so important. In perimenopause, DHEA levels can decline like the rest of it, which contributes to fatigue, low libido, the reduced ability to handle stress, which is why cortisol can go crazy. And so testing this can give you just a more big picture of your adrenal health and a lot more of maybe why your body is struggling to produce the hormones it needs and how you can better support it. These main hormone markers are really important for understanding how your body is adapting to the hormonal shifts of perimenopause. They not only provide insight into your symptoms, but it can help you and your provider create a more tailored plan to bring your body back into homeostasis or balance. So despite what your doctor says, in my opinion, along with a lot of other functional practitioners and even some conventional doctors, it is actually important to have a picture of these hormones even knowing that they will be fluctuating ultimately. Next up, we have more blood markers that are very commonly used for wellness checks and regular screening for disease, which again can just provide more insight into which areas of your body need a little extra support and possibly targeted supplementation. So next we have the comprehensive metabolic panel, or the CMP, and this is basically a snapshot of how your body is metabolically functioning overall. There are markers for liver, kidney health, blood sugar, electrolytes, things like that. And in perimenopause specifically, your liver is working over time to process and eliminate excess hormones like estrogen. So making sure that these are all functioning well is really important. The kidney markers can give insight into hydration, again, metabolic function. So if something is off here, it really can impact how well your body is handling all of the hormonal changes during perimenopause. So I'm going to get into some of the main markers. There's a lot of them in here, but I'm not going to get into all of them. And then some optimal ranges. And I'm going to I put this in quotes because lab ranges, just so you know, are based on an average essentially of the population that has been or has taken tests throughout time with their lab, or they may use other lab ranges. But it is an average of the most unhealthy population in the world at this point. And so normal lab ranges don't necessarily reflect optimal. And so we are going to talk about a much smaller window of optimal ranges versus, again, normal or lab ranges. So keep that in mind. The first is going to be glucose, and this is a fasting marker. So make sure you take your test fasted. So this is blood sugar, and this is just a one-time snapshot of what your blood sugar looks like. Ideally, we want this between 75 and 85 micrograms per deciliter. Anything higher could indicate some insulin resistance, and then lower is you're looking at potentially hypoglycemia. BUN is another one. So this is blood urea nitrogen, and that is, we want this about 12 to 16 micrograms per deciliter. These are a reflection of kidney function and protein metabolism. Creatinine is the kidney filtration and muscle metabolism marker. We want this between 0.6 and 0.9 micrograms per deciliter. And then AST and ALT. So these are liver function markers, aspartate aminotransferase. We want this between 10 and 25 units per liter. And then we want ALT also between 10 and 25 units per liter. So these can be markers if these are high of non-alcoholic fatty liver disease or alcoholic fatty liver disease, if the shoe fits. But that is definitely an important one to be looking at in perimenopause. Next is the complete blood count, or a CBC, and this is a look at your red and white blood cells as well as platelets. So this will tell us if you may be dealing with some anemia, infections, even inflammation, and especially for women in perimenopause, this is important because heavy or irregular periods are really common. And this can lead to low red blood cells or iron levels. So if you're feeling fatigued, weak, the CBC could potentially help uncover some of those contributing factors outside of course, the hormone imbalance. So looking at red blood cell count, or RBC, we want 4.1 to 4.5 million per microliter. Too low could potentially indicate anemia. Too high could be dehydration or other issues. White blood cell count, or WBC, we want between 5,000 and 8,000 cells per microliter. Anything lower or higher could be an indication of immune dysregulation. And then hematocrit, this is the percentage of blood that is made of red blood cells. So we want this between 37 and 42. Anything outside of this could be indicative of anemia or dehydration. And then hemoglobin. This is the oxygen carrying capacity of your blood, basically. We want this between 13 and 14.5 grams per deciliter. Anything lower could be an iron or B12 deficiency. So those are kind of the main ones with the CBC. And then we have a lipid panel. This is super important in perimenopause. So this is cholesterol, your triglycerides, These are going to test both HDL, the good cholesterol. This does have protective properties, and then LDL, or the bad cholesterol, along with triglycerides. So this is the fat in your blood. During perimenopause, the hormonal shifts can really impact your cholesterol levels. It is very common to hear, I didn't change anything about my eating, nothing, and my cholesterol levels went through the roof. And this, of course, puts you at a higher risk of heart disease. So making sure to keep an eye on these markers helps you take a more proactive step to protect your cardiovascular health, which is at more risk as a woman because of the decline of estrogen. And then LDL, or low density lipoprotein, we want this less than 90 milligrams per deciliter, or less than 70 milligrams per deciliter for high risk people. And then triglycerides, less than 70 milligrams per deciliter is what we want to see here. This last one is not included in most conventional lipid panels. You do have to ask for it separately, but this is a newer marker that studies are finding actually gives us better insight when it comes to predicting cardiovascular risk. And that is apolipoprotein B, or ApoB. So the LDL, or the low density lipoprotein, is just one type of low density protein in the blood. The others are very low density protein, or VLDL, intermediate density lipoprotein, and then lipoprotein A. But there is an ApoB particle in each one of those, and all of those together still indicate risk. So doing a test for the ApoB actually gives you a better indication of cardiovascular risk than just the LDL or cholesterol levels alone. So optimal ApoB levels are below 90 milligrams per deciliter for low risk, and below 70 milligrams per deciliter for women at higher risk of cardiovascular disease. So same as the LDL. Next is hemoglobin A1C. So we do have glucose testing in the CMP, but this is just a single snapshot of your blood sugar. The A1C is your average blood sugar levels over the past 2 to 3 months. So hormonal changes in perimenopause do make you more insulin resistant, which means that your body is going to have a harder time processing sugar, keeping blood sugar levels stable. And elevated A1C can be indicative of prediabetes or diabetes, both of which obviously affect your energy, your weight, how your hormones are functioning. So this is an important one to take a look at. Optimally, we want to see it between 4.8 and 5.3%. Anything above 5.7 is prediabetes, and anything 6.5 or higher is considered diabetic. Next, we have a full thyroid panel. This is an insanely common cause of fatigue in perimenopause that a lot of doctors are completely overlooking. Oftentimes, even if they do run a thyroid panel, they will leave out the reverse T3, which is actually a really important marker. So we're going to talk about it in a second. But personally, I would be very specific and ask for a full thyroid panel, which includes TSH, so thyroid stimulating hormone. This is the main thyroid marker that tells us the thyroid is being properly signaled by the pituitary gland to produce thyroid hormones. A lot of doctors will solely go off of this. However, this doesn't mean that it is functioning properly. It means that the signal pathway is working well. We want to see this at 0.5 to 2 microinternational units of substance per milliliter. The next marker is going to be free T3, or triiodothyronine. This is the active and usable form of thyroid hormone, which we want to see between 3.4 and 4.4 picograms per milliliter. Then we have free T4, and this is the available but inactive thyroid hormone, and this needs to be converted to T3. Ideally, we want this between 1.4 and 1.8 nanograms per deciliter. Next is the reverse T3, and this is a byproduct of thyroid hormone metabolism. It is inactive, and it can actually act as kind of a brake to the thyroid, which usually happens when someone is super sick, but it can also become an issue with chronic stress or cortisol dysregulation, extreme dieting, low iron levels, or diabetes. Anything higher than 15 nanograms per deciliter and or a ratio of T3 to reverse T3 greater than 10 could tell us that there's reduced thyroid hormone conversion taking place, which could be causing slowed thyroid function. So this would also tell you that someone would actually need a replacement of T3 versus the most commonly prescribed T4 of levothyroxine, or a combo of those. Next is TPO, or thyroid peroxidase antibodies, and then anti-thyroglobulin antibodies. And these are two markers that can actually help you identify an autoimmune component to any thyroid issues. We want to see TPO less than 9 international units per milliliter, and then the anti-thyroglobulin antibodies less than 4 international units per milliliter. Anything above this could suggest Hashimoto's. This test really goes beyond the basic thyroid check and gives you a deeper look at how your thyroid is functioning. And the thyroid regulates your metabolism, your energy, even your mood. So in perimenopause, these thyroid issues, come up, or they get worse and cause a ton of symptoms. And so knowing whether your thyroid is underactive or overactive could actually be life-changing for your health and how you approach it. Next up, we have an anemia panel. So this checks for different types of anemia, which is when the body doesn't have enough healthy red blood cells. So this would include iron, ferritin, which is your body's iron storage, folate, and B12. So both folate and B12 are needed for red blood cell production, play a role in energy. And then because perimenopause often has those cycles of heavier periods and also changes in your body's ability to absorb nutrients, this can lead to deficiencies in some of these things. So testing for these markers can be really important, especially if you are constantly tired, if you're lightheaded, you're dealing with hair loss. This panel might give you a missing piece of the puzzle. So iron, we want to see between 85 and 130 micrograms per deciliter. Ferritin, we want to see between 50 and 100 nanograms per milliliter. Folate, we want greater to or equal to 15 nanograms per milliliter. And then vitamin B12, we want to see between 800 and 900 picograms per milliliter. Next, we have some inflammatory markers. So inflammation is the body's natural response to energy or illness, but when it becomes chronic, it can contribute to a lot of different health issues, including heart disease, insulin resistance, and even hormone imbalances. In perimenopause, this chronic inflammation really can worsen some of the most common symptoms like fatigue, joint pain, weight gain. So this is definitely something we want to take a look at and address if needed. The first is high sensitivity C-reactive protein, so HSCRP. This is a blood marker that measures inflammation throughout the body. It is especially useful for detecting low-grade chronic inflammation that really might not cause super noticeable symptoms, but it's there. High levels of this could tell us that you have an inflammatory response tied to potentially cardiovascular disease, metabolic syndrome, even autoimmune issues, all of which are far more common during perimenopause. Typically, we want to see C-reactive protein below 1 milligram per liter, while levels of above 3 milligrams per liter could be a sign of increased risk for cardiovascular issues. The next inflammation marker is erythrocyte sedimentation rate, or ESR, and this measures how quickly red blood cells settle at the bottom of a test tube. So the faster rates can indicate inflammation in the body. This marker is a little less specific with what's happening in the body than the HSCRP, so using it alongside the C-reactive protein can just help confirm the indication of chronic inflammation. It points more towards systemic inflammation linked to things like arthritis, even infections or chronic diseases, all of which can overlap with the challenges of perimenopause. Normal ESR values do vary by age, but typically are under 20 millimeters per hour for women. Anything higher would need to be looked into a little deeper. Next are just some individual micronutrient markers that are really commonly low, but really, really important for a lot of different functions in the body. First up is the vitamin D25 hydroxy. This is the most abundant circulating vitamin D in the body, in the blood. While vitamin D is important for bone health, which you might know, it does help with calcium absorption, it's not just for bone health. It plays a huge role in regulation of estrogen and progesterone, which of course impact your mood and your blood sugar regulation and all of the other things, and even immune support. About 50% of women are deficient in vitamin D. So when you couple that with perimenopause or hormone dysregulation, it can worsen fatigue, joint pain, even symptoms of depression. Luckily, a really simple test can tell you if you need to supplement or start adjusting maybe some lifestyle habits to bring your levels back up to optimal. This is something that I know a lot of people do supplement with prior to or even without testing, which again, for most people should be fine. But keep in mind that because it is a fat soluble vitamin and can actually even act as a hormone, there is some danger for toxicity to build up. Toxic buildup. So it is best to just get tested. This we want between 50 and 80 nanograms per milliliter. And then we have zinc. So this is a trace mineral. It helps with immune function, wound healing, even hormone production. It is also essential for balancing cortisol levels, something that obviously becomes really important during perimenopause, as we know. And low zinc might show up as slower healing times, getting sick often, even issues with taste and smell, adrenal function or dysfunction. We want to see this around 90 to 120 micrograms per deciliter. Then we have magnesium. This is a major mineral. It supports over 300 processes in the body, including muscle function, stress response, sleep. It also helps regulate blood sugar and hormone balance. Despite the importance of this mineral, over 50% of the population is low, and stress during perimenopause will often make this deficiency even worse. Testing your levels can help determine if you need to supplement, but keep in mind the best way to test this is actually within the red blood cells. So pure serum or blood levels will tell you what's in the blood, but not necessarily what is getting used by the cells. So you have like a calcium shell or something like that, which can be found out by an HTMA test. We won't get into that today, but that would, even if you had the magnesium, it's not being used by the cells. So the RBC measurement will give you that. So we want to see this between 5.5 and 6.5 micrograms per deciliter. So that is all the lab markers. Again, just kind of foundational lab markers that can, yes, they can be diagnostic, but they can also just really help you navigate symptoms and find the best support for your body. Now, how can you approach this conversation with your doctor? Advocating for your health starts with being prepared and being proactive. So if you want to request labs like these, it's really important to communicate your concerns first effectively, and then navigate the conversation with confidence. Even if you don't actually know what the heck you're talking about, pretend you do, because that's going to help your doctor be like, okay, she wants this. Let's go for it. First off, I would suggest keeping a journal of your symptoms. Before scheduling your appointment, spend at least 1 to 2 weeks. Over a month or two would be absolutely amazing. But tracking your symptoms, the intensity, the frequency, the severity of them, that's the same thing, but make sure you include your physical symptoms. So any fatigue, weight gain, hair loss, joint pain, emotional changes, mood swings, anxiety, depression, irritability, timing and triggers of symptoms, whether they worsen after eating or during specific times of the menstrual cycle. This is really common and can help, again, kind of pinpoint, especially if you test at the right time, what's going on. There's also cycle mapping options that we could do functionally, but you should also be keeping track of your general menstrual cycle if you're not already. This is not only invaluable in terms of treatment and tracking progress, of course, testing, but also with whatever intervention you use. It shows you how effective it's going to be, obviously, as you track those things and track your progress. But it also shows your doctor that you're paying attention to your body, and it provides them with some objective information to help kind of guide the conversation. And then when you're actually talking with your doctor, be clear about why you want these specific labs. So you could frame your request in terms of maybe identifying underlying causes, improving your overall health. So for example, I've noticed a lot of fatigue and trouble losing weight. I would like to check my thyroid and hormone levels to see if they're contributing to some of these issues. If they seem hesitant at all, I would absolutely also mention that this comprehensive lab testing does align with the current guidelines for preventative care and hormonal health, specifically in women approaching menopause. You want to be assertive, of course, like I said, confident in what you're saying, but you also want to be collaborative. You don't just want to walk in barking orders. Coming to the conversation as a partnership with your doctor can be really helpful because ultimately that's what it should be. So using verbiage like, I really value your opinion and I would like your guidance on exploring some of these labs to rule out underlying issues. Bringing in things like, I've done some research and these labs seem relevant based on my symptoms. Like, what do you think? Asking these things can, again, just make this more of a conversation. And it shows that you are respecting their expertise and knowledge, but also advocating for yourself. Then if your doctor says no for whatever reason, stay calm. I personally would have to take a couple of breaths and see if you can explore some alternatives. So asking for an explanation. Can you help me understand why these tests or why you don't think these tests are necessary at this time? Maybe they have something else in mind. Maybe they would like to start somewhere else, which also might be totally fine to begin with, at least. You could also offer to self-pay this if you have the capacity, right? Sometimes doctors hesitate to order tests that are not going to be covered by insurance. So if you're able to let them know that, again, if you're willing to, or if you're able to pay out of pocket if necessary, then that could relieve maybe some of their hesitation. Maybe if they won't order the full panel of whatever of all of these markers, ask if maybe they can just order a few key ones based on your specific symptoms, like TSH, free T3 for thyroid, or maybe an iron panel for fatigue, again, as a starting point. And then lastly, go for a second opinion, right? Know that you can get a new doctor. You can work with someone like us alongside your current care. If your doctor stands their ground and strictly will not run any testing, personally, I would find a new doctor, but I know that can be difficult, especially if you've been with them for a while. But obviously, you have the right to at least seek another opinion. There are tons of telehealth options at this point. There are functional practitioners like us who are willing to support your health in the best ways without the constraints of insurance that oftentimes are actually more affordable than going to your doctor and even paying out of pocket, unfortunately. Most importantly, remember that your health is a priority and you deserve answers. Right? Reiterate your goal of identifying the root cause of your symptoms, not just trying to treat them superficially. And maybe a final approach could be, I want to be proactive about my health, especially as I approach menopause. These labs feel like an important step to me to understand what's going on. If you're unable to order them, can you recommend someone who can? Sometimes this can be a little incentivizing without being directly like, I'm going to go find somebody else, and maybe prompt them to be a little more flexible in their approach. Obviously, being informed, I'm hoping this podcast helps you do that, and prepared going into this conversation will help you feel more confident in navigating it, even if it doesn't necessarily go as planned. So I hope this was helpful. As we wrap up today's deep dive into the most impactful blood labs for perimenopausal women, I want to leave you with this. Your health is ultimately in your hands. It is your responsibility. And I know that while navigating perimenopause can feel really overwhelming at times, understanding what's happening in your body and using tools like these lab markers gives you power to take back control. These tests don't just provide answers, they actually open the door to be able to tailor solutions to what you're personally experiencing. This phase of life is not just about getting through and surviving. It is about thriving in a way that honors your body. It sets you up for long-term wellness because that is what we're all about here. You absolutely deserve to feel vibrant, balanced, strong, and the right testing is often the first step to making that a reality. If you want this list along with a little bit deeper dive, we have put this all into our midlife mastery guide, which we designed to help you navigate this journey with clarity and confidence. So I will link that in the show notes. I hope this was helpful, and we'll see you next time. Thanks for tuning in to this episode of the Fitness Simplified podcast. We are stoked to have you join us on your journey to better health and fitness. If you have any questions, suggestions for future topics, or just want to chat, feel free to reach out to us on Instagram at Brooke_Elysian and Facebook linked in the show notes, or via our website, ElysianWomensWellness.com. If you enjoyed what you heard today, we would be thrilled if you could take a half second to leave us a 5-star rating and review. Not only will you be helping others find our show, but you'll also be entered into our monthly $100 giveaway for new reviews. If there was something you heard that was helpful or impactful, please screenshot it, tag me, and share what it was so that we can bring you more. Plus, you'll be entered into our monthly Elysian Recharge post-workout giveaway. New episodes drop every Monday, so make sure to hit that subscribe button and stay tuned for more. Thanks for listening.